Thanks for joining us today, everybody. In the spirit of reconciliation, we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islanders. My name's Nell Thompson. I'm the Secretary of the Australian Institute of Animal Management, and I'll be hosting the webinar for you today. I've been on the AIM committee since 2013, and I'm also the coordinator of the National Getting to Zero program. The Australian Institute of Animal Management, or AIM as we call it, is the national peak body representing local government animal management officers. The AIM committee consists of a wide range of professionals engaged in the various aspects of animal management. And we seek to support those engaged in the business of animal management and the function itself by providing training and information, opportunities for networking and collaboration, and by encouraging the use of best practice policy and practices. We understand the significant pressures placed on local government and not-for-profit rescue and rehoming service providers when working in the companion animal management space. We welcome new members, and people can join via our website at aim.org.au. So to today's presentation. Once I hand over to our presenter, there'll be around 45 minutes of presentation and around 15 minutes of question time once the presentation's concluded. The recording of the webinar will be accessible via our website to all members to watch at any time. We're going to ask that everyone mutes themselves during the presentation unless our presenter indicates otherwise. And if you have questions, you can start putting them in the Q&A section and we'll get through as many as we can at the end of the session. If you have very quick questions that relate to your understanding of the content, put your hand up and we'll try to get to them during the presentation. And if you have more questions or we don't get to yours during the question time, you can send a message to our Facebook page and we'll get to it that way. As always, please excuse any working from home background noises that may filter through. We are excited to have Dr. Anne Enright here with us today to talk about the hot topic of cat management. After 18 years in human resources, Anne completed a veterinary science degree at Murdoch University in 2008. She then completed the graduate certificate and fellowship in shelter medicine and is currently finishing a master's in shelter medicine. Anne has worked or volunteered at animal shelters in Australia, the UK, Europe and the US. Some of her proudest achievements are assisting shelters improve operations with amazing financial and welfare outcomes, establishing community veterinary clinics and co-founding special interest groups as a resource for disease management, operations and networking opportunities. Currently, she's working with international groups to expand networking opportunities for animal welfare organisations. Access to affordable DeSexing services is the key to reducing companion animal management, companion animal overpopulation, pound shelter impoundment, and euthanasia. Committed to reducing unnecessary euthanasia, Anne has helped establish Westside Community DeSexing, a not-for-profit veterinary clinic providing affordable DeSexing services to the communities in Melbourne's western suburbs. Her goal is to assist animal welfare organisations make positive changes to the animals in their care, and her motto is to make a difference and shape the future. So over to you, Anne. Sorry, Anne, you're just going to need to unmute yourself.
Okay, have I done that now?
You have, thank you.
Okay, sorry. Okay, let's try. Sorry for that. Hi, everyone, and thank you for taking time out of your busy day today to come and join us this afternoon. And welcome from a COVID lockdown Melbourne. I have my mask, so the cat and I here should be fine. At least it's sunny though, so I guess that's positive. I know Nell's already quickly talked to you about what I'm going to be talking about, but my goal today is to give you some ideas on how you can save dollars and reduce the unnecessary euthanasia that's still occurring in pounds and shelters and so forth across the country. So I know Nell's just gone through this as well, but I thought I'd just quickly give you a little bit of a synopsis into my background as to what actually happened and what was the triggering point for me to go down this path of shelter medicine and improving cat management and so forth. I started off straight out of uni as a shelter vet with one of the largest cat pounds in Western Australia, Cat Haven. And they, at the time, they had an intake of about 8,000 cats a year, which is quite a number of cats to have to deal with. And they had a euthanasia rate of about 60 to 70%. And I'm horrified to think about that now, but at the time, I didn't know any different. I thought that's just how it was. They're not sitting at that now, of course. They're sitting in, I think, single figures. I think they're under 10% for their euthanasia. So they've made amazing changes. But it was just an everyday, it was just an ordinary day, and we would just put down cats. It was something you just did every day, at the end of the day, and sometimes if you're unlucky, you did it at the morning as well. And there was one day there where it was sort of must have been the turning point, and I was standing around and I was up to about my number 96 euthanasia for the day. And I was just looking at the body bags, which were just stacking up all around me on the floor. Both freezers were full. And I'm just looking at all these body bags thinking there just has to be a better way to do things. There has to be another way apart from putting cats in body bags. And I believe things happen for a reason. And, you know, there's always a reason that something will turn up. And as it happened, I was going to a conference in a few weeks' time over in Europe, and it was run by the ISFM, the International Society of Feline Medicine. And there was a speaker there from Florida, University of Florida, Julie Levy, who is an amazing person and has one of the experts in shelter medicine in the States. And she was giving a presentation on shelter medicine, improving animal management, improving cat welfare, reducing euthanasia. And I thought, well, I might just go to that because that's pretty much what I do. And she was the turning point for me. She was what she said just pressed all my buttons. She delivered every single piece of information that I needed to know. And from that point on, I made it a decision that I was going to learn absolutely everything I could about shelter medicine, about animal management, about improving animal welfare and reducing euthanasia. And that's what drives me to do what I do. And people that know me know that my passion for this area is enormous. And this is what drives me. And I want to actually be able to share some of it with you today, because you'll be able to make huge changes and make huge advances with little or minimal effort. And you just need to change what you're doing and just do things a little bit differently. So let's get started. But before we go, I just want you to think about today. Why did you choose to sign up today? I know there's over 80 or so people that have signed up for today. So why did you choose to listen? What are your goals? And what's stopping you achieving your goals? Now, I make no apology for using soccer references here, particularly as Melbourne's about to lose the AFL Grand Final. And so soccer is my favourite one, so that's why I've chosen that. And then, do you have a roadmap to achieve these goals and to get around these roadblocks? What do you have in place, and what does it look like so that you can get to that flag at the end? Or does your roadmap look like this? So by the end of today, I hope you will be able to put a few more words into the box there in your plan. Kitten season's coming. Now, I know you don't need me to tell you that, and I put these slides together a few weeks ago, and so I was at the time thinking I would be saying, well, kitten season's, approaching, but it's here. Because last week when I was down at a place doing some surgeries, I pulled 18 little marbles out of 3 cats. So it's here. Kitten season's here. It's going to hit with a vengeance, and we're going to be in trouble. We've all seen these sorts of pictures. We're familiar with these pictures. I got this picture from a friend on the course that I was on, so I'm not sure where it was taken, but we've seen it. We've seen them around the industrial areas and problem areas and other sorts of things. We're all familiar with that. We're all familiar with getting these left at the door as well. Kittens in a box. Small kittens that we were told to euthanize because they were too small or whatever. We didn't, but that's where they were destined to go. And there probably will be some people that are around that would have come across situations like this. This is, I got this picture from one of the courses that I've done over the years. This is fortunately out of America, but some of you will probably be familiar with this. And fortunately, this is not as common as it used to be. We're all familiar with this man. He's a clever man. Apparently, I didn't meet him, but he's a clever man. Has a few bright ideas, and one of them was insanity and you know, doing the same thing over and over again and expecting different results. Well, unfortunately, I mean, we're in that boat there when you're talking about cat management, because for years and years and decades, we've been doing the same thing. We've been applying the catch and kill method. Year after year after year, we've done the same thing and we've expected it to be different. And it clearly isn't, because it's not working. I mean, if it were working, then we wouldn't have a cat overpopulation problem. We wouldn't have shelter euthanasias and so forth. So clearly it's not working. We need a new approach. We need to come up with something different. And in order to do that, you need to have a plan. You don't have to have a very complicated plan, but you need to have a plan, or, as I had previously, a roadmap. Why do you need a plan? Well, these are some of the comments. I've put these up from comments that I've received from talking to people like in the community and different councils at different functions and conferences. Resources. You guys have limited and stretched resources. I know that. You tell me that. When I try and talk to councils about implementing DeSexing programs, subsidised DeSexing programs, they tell me it's a great idea, it sounds like a great idea, and we haven't got the money to do it. So I know that your finances and your staff are stretched. If you were able to manipulate what you do and save some of the money, redirect your savings, you'd be able to offer more programs. Community expectations. If you just think about what we did in the workplace, for those of you that were around back then in the 80s, you'd never get away with some of the things that were happening in the workplace now. And it's the same with community expectations. Years ago, the community probably didn't mind or turned a blind eye to the number of euthanasias that were going on in shelters. The community probably didn't even have a clue what was going on in the shelters. Where now they've got a much more vested interest. They're keen to know what goes on with the animals that are in there. They expect better outcomes. They expect that the animals going in there will come out alive. That's the LLR there, the live release rate. So they're expecting that that is improving. And the community now deems euthanasia as a means of population control just unacceptable and ineffective. And the community, as we know, we've seen, you know, social media and the attempts on social media to highlight these issues. So we know that the community doesn't accept it, and we know that we need to pick up our game and look for other programs and methods of creating better outcomes. And the final point I've got down there is euthanasia. And I've got down there that it's expensive. And it is. It's an expensive process. The actual lethabab that you need to euthanize a cat is not, right? You need 3 mils and it's only a couple of dollars. But that's not the expensive part. It's the emotional destruction of everybody that's involved. That's where the expense comes in. It's the destruction of, and just the moral destruction of people, those that are involved in the trapping, those that are sitting out at the front gate of the shelter knowing that when they take these little kittens in, they're not going to make it out alive. It's the people at the shelters and the pounds that have to do it. And it's the community that they, as I said before, they don't expect that animals should go in there and not come out alive. And it's a waste of resources. And that's all that, you know, that's just all that it is. It's just a waste of resources that need to be redirected into more productive programs. So It doesn't work. Euthanasia doesn't work. We need to have another option. Before I start talking about other things, what you need to know as an organisation, and some of you will know this and some of you may not, but what you need to know is how much does it cost your organisation, and how many of you are able to actually say it to the dollar how much it costs from when you receive the initial call. So you have Mrs. Smith down the road who's planted all of her tomatoes, and then there's a cat that keeps coming into her yard and scratching them all up. So she's annoyed, she's had enough. So she rings the council office. You need to pay somebody to take the call. You need to pay somebody to redirect that call, and then it goes into the animal management team. Then they need to actually make contact with the person. All this is time. All this is people's time, and it all costs money. They then need to go to the site. They need to take the trap. They need to explain how it's done. They need to go back and recheck it. And so that might be 1 trip, 2 trips, who knows? So they need to go and do all of that. And then when they do get the animal, they need to redirect it somewhere. It's obviously, it might be easier for dogs because you can possibly just take them back to the house if the gate's open or something like that. But for cats, they never just get taken back. They're usually just taken straight to the shelter or pound. So do you know how much all of these procedures cost? I've raised this with a couple of people from different councils, and they've come back with some numbers for me, and they've told me that it can cost $200 to $300 in time and people power and so forth to actually do those first 3 components there from A to C. If you have your own pound attached to your facility, then you don't pay pound fees. But if you don't, then you need to then take the cat to an organisation and they will charge you. They will not say, bring it in here for nothing, thank you very much. They will charge you per beating heart, as an animal management officer once commented. And I like that comment, so I've stolen it from him. But so they're paying per beating heart, as he said, and you're paying a lot of money. You'll be paying anywhere up to $300 per head. So you need to add that to the amount of money that process is already costing you. If you have your own pound facilities and you hold the animal until it's adopted, in Victoria there's an 8-day stray hold, so you have to hold them for that period of time. You have to pay for that. And if it costs about $20 a day to feed and clean and house the animal, then there's 8 lots of $20, so there's $160. You add to the hundreds of dollars already spent. And if it takes longer than 8 days to rehome it, you pay for that. Some of them will need veterinary or treatment or surgery, or if you have a philosophy that the animals have to be adopted DeSex and they're not, then you need to pay for that. So all of this costs up. So you're not looking at just a few dollars here. You might be surprised to find out, but you're actually looking at spending possibly up to $1,000 per situation. So by the time you do that, for 500 cats or whatever you're doing for, it's a lot of money. And I guarantee I can make better use of that money within your organisation that will save you money. This I put together from, just to give you an idea, for those of you that don't know, how much money you're actually spending in pound fees paid per head. Now, I know that there are places out there that are paying these fees because I've actually, when I've been in organisations, I've seen these invoices on desks. So I know that there are organisations that are paying $150 per beating heart and some that are paying $300. So I don't know what you're paying, of course, but you might have some idea. So this is the sort of money that you are paying annually, depending on the number of animals that you're taking into the pound. Some of you might not be taking very many at all. You might not even be taking 250. Well, so that, that column, according to you, would look much more healthily than that, what we've got there. Alternatively, if you're in an area that has a lot higher concentration of cats that end up in the pound, your figures aren't going to be quite so attractive, and it's a lot of money. And I've just put that bottom row down there just to show you, if you can introduce a few concepts, a few programs and initiatives that will drop down your number of animals going into these shelters and pounds, you're saving yourself potentially hundreds and hundreds of thousands of dollars. And I can guarantee I can make much better use of that money for you than you just giving it into shelters and pounds to pay for animals, you know, that we can avoid. Data. I thought I'd just quickly talk about this because nobody likes data, or some people might. I don't. It's tedious, but it's so important. It's so important to have an idea of what you're doing, and it identifies your trends. It helps you with your organisational planning, right? And there's all these points here. You'll know all of these, probably most of you, but you'll know, you know, with your goals and your equipment and your seasonal requirements, so forth. You have the advantage this year because a lot of the organisations are doing damp plan assessments again, because I've been submitting some submissions for some of those. So you've got now an opportunity to look at what you've got in there for your animal management plans and maybe make a few little tweaks and some changes, and you can introduce a few new programs and initiatives that will help you. You want to be able to improve on your reputation. You want to be known as a council or an organisation that values animals, appreciates the human-animal bond, wants to preserve that, and doesn't want to be involved in being associated with an organisation that has a high euthanasia rate, because that does nothing for your reputation. Data will give you strength in your applications if you're after grants. Now, I know some of you actually award grants to organisations, but you might also be eligible for state or federal grants. And if you've got data, that will help you. It also helps you with, you know, achieving your KPIs, because everybody works toward those, and that's what money and grants and budgets are all assessed against. And it also enables you to, it strengthens your case if you're wanting to achieve awards, because organisations, if they're doing a good thing and they're achieving good things, they should be eligible for awards. They should be able to get those. And then you should, if you do win an award, you should be letting everybody know about that, because that then goes back and enhances your reputation. So whilst data is a tedious thing, I think you need to actually really hone in on it and make sure you're capturing everything that you can, because it's going to help you achieve a lot of good things. I put these things together. Initially, when I did this, I had a huge long list, and I thought, oh, that's you know, too many points to talk about. So then I thought about, when I talk to organisations, shelters and other councils and so forth, and they, you know, talking to them about how they can go about improving what they do, what they should be looking for. These are the 4 things that came to mind, and these are the 4 things I need to know. Your hotspots, your origins of where the animals are coming from. You will all have an idea of your problem areas, and if you don't, you should know where they're coming from, because that's where you need to target. You need to put your efforts into getting those areas under control. You will probably know this, strays versus surrenders, and also with point number 3, whether they're DeSexed or microchipped and so forth, how old they are, because that will give you an indication of the type of programs that you need to be thinking about introducing to try and reduce the numbers representing those areas. And euthanasias, I mean, councils, if you don't have your own pound, and even if you do have your own pound, you need to know why the animals that you're entrusting to those shelters and organisations, why they're being euthanized. You know, you can be told sick temperament or for space, but you need to know why, and you need to be able to ask the question and get an accurate answer. You have currently available, there's in Victoria, there is the survey up and running, which is pushing for the pound and shelter management transparency component. So you need to be able to ask, why are the animals that you're taking into shelters and pounds, why are they being euthanized? What is the reason? because that all goes back to community expectations and mental well-being of staff and all these other issues too. So you have to be able to ask those questions and get accurate answers. Briefly, just why do you want to track these sorts of things? So that you can work on your KPIs, which will then direct you toward programs that you can be putting in together. Your DAMP plan objectives, you can now have the opportunity to change those that will help the council. Animal registrations, you'll have a better idea of how many animals you have in your areas and where they're located. Again, your community reputations and expectations. Rescue groups, I put them on the list too, because rescue groups are an extremely valuable resource to everybody. They take in a lot of animals, they take a lot of pressure off the other organisations, and you need to be able to work with these groups in like a collaboration. And whilst they take they will take animals from you and it will make your figures look good, you need to understand that you just can't dump animals on rescue groups. You need to find ways to assist them to do their job, and by offering desexing programs and subsidised desexing programs for members of the public plus rescue groups, you will overall make a big impact and help these groups work more effectively and efficiently. And then again, legislation updates, I mentioned that the survey before, Prevention of Cruelty to Animals Act. There's lots of opportunities where if you've got reliable data, you're able to make really valuable comments into legislation changes that can only progress animal welfare and animal management. So I put this slide in. I'm always amazed at this, just how something very straightforward and simple can have such an impact. Now, this is data that I got from a project that I had to do as part of one of the courses that I was doing. And it was really just measuring the impact of a desexing program that we were running. And we were running it in conjunction with Banyul, the Banyul Council. And so it was over a 2-year period. And these are just the number of cats that were desexed from members of the public. This does not include any of the shelter surgeries that we were doing at the same time. So over a 2-year period, when I was tracking the numbers, so you can see that I did just over 3,000 surgeries over 2 years. The data suggested that I'd done probably roughly about 50-50 males and females. I don't know, it felt like I did far more females than I did males, but that's not what the data was saying, so we will go with that. So if we just look at the number of spays that I did, so if I've just done about, just over half of them, there's 1,600 spays that I've done. So if you're using the assumption that we have an average of 4 kittens per litre, and I know some are more and some are less, so we just averaged it at 4. In 2 years, we prevented over 6,500 kittens potentially entering the system. And I was amazed that so many kittens could be prevented by just that small effort that we did over 2 years. I mean, and who does not want to have to deal with 6,500 extra kittens? I mean, nobody wants that problem, and everybody would like to be in that boat where you don't have it. And it just shows how that's only 800 spays a year that we did. And it just shows how much you can achieve from just focusing on one small component of the whole program. I'm always amazed when I see that number. And that was part of the Vanguard Sexing program that we did. And it was Jenny Cottrell who drove that program, and she introduced it years ago. I came in after it had been going for a year or so, and when I came in, it was well on its way. There were 2 clinics that were involved in the program, us and another clinic in the area. And what Jenny did was she she identified the areas that were the problems, like the hot spots where the repeat offenders were. And she targeted those areas there, and she offered a sponsored desexing and microchipping campaign. So twice a year in April and August, she would desex or encourage 30 owners or 30 cats, some owners had a couple, to desex and microchip their cats, and the council paid. She was also absolutely brilliant at encouraging people to officially adopt cats that they had been looking after for years, but it wasn't their cat. And she tells a story of how there's, let's say it's Mrs. Smith, who lives next door to a rented property. The tenants move out and leave the cat. The cat gets pregnant, it's not fed. Mrs. Smith feels sorry for the cat, so she feeds it, but she feeds it down in the backyard, right? Because it's not her cat. And then it starts to rain, so then she starts to feed it at the end of the porch. But it's still not her cat, but she's feeding it at the end of the porch out of the rain. And then it gets cold, and winter comes. And so then the cat comes into the laundry to be fed, but it's still not her cat. And she's been doing this for a while now, and it's had a number of litters of kittens. And then all of a sudden the cat ends up sleeping on the end of the bed, but it's still not her cat. And Mrs. Smith doesn't want to pay to have her cat desexed and microchipped because it's not her cat, and she can't afford to pay the $300-400 that's involved in getting a cat desexed and microchipped. But when Jenny came along and she encouraged people like this to officially adopt the cat, take care of it, which they already have been, and they offered to desex and microchip it, and Mrs. Smith was happy to do that. And so she was able to also encourage a lot of stray, unowned cats to become adopted, to become desexed, microchipped. Then they were registered onto their system. So they then had an idea of how many cats they had in the area. And in doing this program, she was able to reduce the number of cats that were going into the shelter over a period of time from 1,006 to 171. Now that's a reduction of over 80%. Right now, what council does not want to reduce the number of cats that they're taking into a shelter or a pound by 80%? You know, none. Everybody wants to achieve that. And from the shelter perspective, what actually happened was that we ran out of cats and kittens that were available for adoption in summer. So who runs out of kittens for adoption in kitten season? But we did. We didn't have any. We had to bring them in from other shelters that were overflowing. So we were bringing them in from 3 or 4 other sources just so that we had kittens and cats available on the weekend for people to adopt. So this was just showing how targeting desexing drives and hitting the hotspots, it's the #1 way to make an impact. And I'll just show you this. If you just use the numbers that Jenny had from Vanguard, so over a 6-year period, she reduced the intake, like I said, from 1,006 to 171. Look at the difference in the fees that you would be paying depending on what you're paying currently. Like, it's huge, the amount of money that you would be saving. So I know I keep harping on about it, but I just want to show you the financial gains that you can make by just putting in a little bit of effort and time for a few years. You need to commit to doing this for a few years. This, if you get anything from this presentation today, I think the next 4 or so slides hopefully will be the most interesting for you and give you enough information so that you can go back and convince people to try this. Now, this side's really, it's busy, it's got lots of numbers on it. I apologise for that. I've had multiple goes at trying to make it clearer and easier, and anybody who is good at doing tables and so forth and is happy to give me a hand, I'm most welcome and would really appreciate it, because I'm a full believer in you do what you're good at, and clearly doing tables is not what I'm good at. I spay cats. Right. So if you just bear with me, I'll try and explain what I've got here. On the left there, the column, the estimated pound fees. That's just information I'd taken from a couple of slides ago. and I just narrowed it down to two points there. 250 cats going into a pound a year or 750, to try and show the difference between whether you've got a large or a small catchment area. And I just picked the middle price point, 210. So I know, you know, some of you pay more or less. If you pay less, well and good, your numbers won't be that bad. If you're paying more, then you're probably going to start to cry because your numbers will look way worse than that. Now, if we look at subsidising, so the council's paying for the desexing, the microchipping, and even a vaccine for 100 cats. Let's just work on 100. I picked 100 just so that the numbers were easy for me to do. And the council's going to pay $160. Now, I've got $160 there for a reason. I'll tell you about that later. But if we just work through the chart here, and then going back to that project that I did, where it's saying that I did 50% of the surgeries were male and 50% were female. So let's just work on the 50% bit. So we're going to desex 100 cats, of which 50% of them are females. So if you're using the average of 4 kittens per litter, just in that, you've prevented 200 kittens. I've set $160 to desex, microchip and vaccinate, and that will be obviously $16,000, and that's going to cover males as well as females, not just females. I've included in that an F3 because I think that council should consider vaccinating cats as well, because as we know, panleukopenia is alive and well, and it is very easily preventable by a vaccine. 2 vaccines, of course, are better than 1, but 1's better than nothing. So anything to try and reduce the incidence of panleukopenia in the environment, because it's a horrible thing. It hits the immunocompromised and the immune immature and the young, and they die a slow and horrible death, which then can impact upon community health as well. So, you have dead kittens and cats just dying under bushes and so forth. That's not a very healthy thing. So I put that together for that. So that's what I'm suggesting that you consider. And you spend 16 grand a year. So like I said, you've got there, you've stopped 200 kittens being born. So if you look at that first line where you take in 250, I didn't think that you would immediately only be taking in 50 cats. I appreciate, so I'm talking about this one here now. So I appreciate that some of them are going to slip through the cracks, and some cats are going to have more than 4 kittens in a litter, and they're probably going to have 3 litters a year as opposed to 1 or 2. So you might be able to take 100 off your list. So you're only taking in 150 cats instead of 200. So immediately your pound fees go from 52,500 to 31,500. So you can see immediately you've made about a $20,000 saving. And then if you add the 16,000, which you have to pay, then you're paying $47,500. So already you're 5 grand up. And that doesn't take into account that you've already desexed 50 males and the impact that they can have on the reproductive cycle as well. We're just talking about the females here, and it also doesn't take into account the money that you save because you're not out there trapping and catching and traveling backwards and forwards and doing all those sorts of things. And then if you just look down into the next line, like 750. So I'm down here now. So you've got 750 animals normally. We're going to desex 50 females, and we're not going to possibly take out 200 off that tally. Again, some will slip through. I'm suggesting you might overall, reduce your numbers by 150. Again, look at the savings that you make. And the total there, the 15,000 that you've got there, will pay pretty much for the next year's desexing program. The catch here is that you need to do it for multiple years, which is what Jenny did with Vanguard. Just doing it once isn't going to achieve anything. If you're wanting to do it and achieve things, you need to commit to a 3 or so year program to really see the benefits. So I hope this table makes sense. And I know the numbers are, they're not specific to any council, but what I'm just trying to show you here is illustrate the type of saving that you can make. Let me see what we're doing there. So how to do it. I've got here what you need. You're going to need someone within the council or the organisation who is keen to drive the program, who wants to make the change, who wants to reduce euthanasia down to 10%, roughly thereabouts. Like, I appreciate that there are animals that will go into the shelters and pounds that will be euthanized. I accept that there's a component of it. I don't accept that 50% of the animals going in, that will be the case, but I do appreciate that there will be a smaller number for that. And you want somebody, you need to clone a few of the Jenny Cottrells around, because you need to have somebody who is desperately wanting to use the council resources efficiently. And I showed you on the previous slide how much money it's potentially possible to save. And you also need to have team support for that individual. You need to have somebody up there saying, okay, let's try it. Let's commit to this program. Let's put it in place and let's give it a go for 2 or 3 years and see how it just pans out. So you need to have somebody or a couple of people that are keen to do this. You don't need an army of people to do this. I'm just point out here, Vanguard, so Jenny and our team, we did it, and there were only 4 of us that did this. So there was Jenny that drove it through the council, and she really worked hard on it and pushed it through the council and did all the council side of things that worked. And then there were 3 of us at the clinic that did it. There was myself and the 2 vet nurses, Janelle and Trish, who were amazing with this and who actually ran with as much enthusiasm and passion to get this to work as what I had. And that's how we were able to pull it off. You don't need a lot of people to do this. You just need people that want to make a change. And I'm actually hoping that some of those people will be you here today listening. I put these points up here, and these aren't my points. These are comments that I have heard from people in the different councils that I talk to when I talk to them about introducing some of these programs. This is the feedback that I get from the animal management team. Different councils, different times over a couple of years, I've put these together. But what they're saying is that you need for it to work is that you need to be approachable. You need to be seen on the street as being someone that's going to be helpful, wants to help the people in the council areas, your residents and so forth. They want to offer assistance. They don't want to be going for the punitive approach, like issuing the fines, issuing the fees, all those sorts of things. They want somebody that is going to, that they know that they can go to, who is going to help them. And that's been mentioned a number of times. And there's a number of people that have said, when I've started to talk about this, what we did with Vanguard and how we went about it and did it, and they've said, oh, we've tried that, we've done that, we've tried that, it doesn't work. In that case, you need to sort of look at whether it's actually a program issue or like an attitude issue, and whether there's somebody in the organisation, maybe further up, that's actually doesn't understand what we're saying, isn't interested, or is just a roadblock in some way. There's lots of reasons why that could be happening. But if you've been trying to introduce these things, then maybe you need to think of another way to go about it, because maybe it's not the fact that you've got access to veterinary clinics that's the problem. It's the fact that it's an attitude problem somewhere along the line, and you just need to find another way around it, because all roads lead to Rome. You don't need to all go down the same path. There are different ways to go about it. And what was successful with Vanguard was that when they were doing this free DeSexing program, they waived their first year of registration so that the owners weren't looking at having to pay that registration as well, and it was only, yeah, it's $25 or whatever it is. And so they knew that that would be coming in 12 months' time. And so that just was, you know, a bit more of icing on the cake to help them accept the program and participate. You need to have affordable desexing opportunities. I get that, because you can't do it yourself, right? You can't get out in the back shed and just do it. You're not supposed to. So you need to have partnerships with, obviously, veterinary clinics. And in the slide following, a couple of slides following, I've got some options for you. I've talked to a few groups and we've got some options for you. Some of you will already have partnerships with clinics and so forth, and that's really good. You need to either be offering free or subsidised services to different groups, the hotspots, your repeat offenders, your homeless people, or people who are financially challenged and are tossing up whether they're putting food on the table or they're paying for, you know, the desexing procedures. I just did a quick tally of the costs that it would take, that it's going to cost at a local clinic where I've worked in the past, to desex, to microchip, and to 1F3 vaccine for their cat is $465. So that's a lot of money for people that don't have it. And if they're going to decide whether they're going to spend $400 on school fees or uniforms or food or desexing the cat, they're not going to spend it on the cat. So they're the people that you need to help with the free subsidised desexing programs. There are other groups of people that you could offer subsidised, so they pay some of it. I know some of the councils use the vouchers. So you need to look at how you can maximise that in the areas that are problem areas for you as well, and that will help reduce the number of animals that you've got going into pounds and the shelters. You need a targeted focus. I've said it a number of times. There is no point sprinkling your precious $16,000 on your 100 cats. There is no point just offering it willy-nilly to everybody. Not initially, there isn't. You will get much more bang for buck if you go to your hotspots and target that. And even if you put 80% of your effort into that area and you keep a remaining 20% and you share that amongst the more deserving areas or problem areas in the rest of the council. But if you just sprinkle it like confetti over everything, you're not going to achieve what you wanted to achieve, and then you'll be thinking, well, the program didn't work. When it had the opportunity to work, it just wasn't focused enough. And like I said before, you need to commit to a particular length of time. You need to do a 3-year or more plus plan. You've got to think of it like weight loss. I can guarantee if you eat salad for a lunch for a week, you are not going to lose 10 kilos. Right? I can guarantee that. So what you need to be looking at is committing to this for a 3 or more year plan before you start to see the results. And that's what they did at Vanguard. They did it for 6 years, and by the end of 6 years, they were down 80%. They weren't down 80% after the first year. They might have been down 5%, but they weren't down at the 80% impound rate that they achieved by committing to it for a period of time. So you need to do that. And you also need to engage your community, right? You need to use them to promote what you're doing and to support what you're doing. So you need to connect with those people. You need to connect with your repeat offenders, your homeless people, people that are financially constrained and challenged, socioeconomic areas. You need to look at your languages as well, the groups within that, because they may not understand something. And so they're missing out. It's not that they don't want to do it, but they're missing out because they actually don't understand the English. And the community groups, they'll help you with your reputation. And word of mouth is the most powerful thing, as we know. So you're wanting to take advantage of that, and you're wanting to get in with these community groups, and you're wanting to promote what you're trying to do to actually achieve what your goals are. And Melbourne-based. If you're Melbourne-based, I know some of you aren't, but what I've done is we're trying to set up a, let's say, a ring of steel. I know that's already been used for COVID, and I couldn't think of anything else, so I just used that. But I've spoken to these two groups here. I mean, Melbourne lacks a lot of community veterinary services and clinics, and there are a few around that are trying to set up to offer these sorts of services to people that, you know, can't afford the $400 to DeSex the cat. So I've spoken to these people. I haven't talked price, but they're more than happy to talk to councils that are in these areas. So down the southeast, they're down sort of Cranbourne. Louise Cook, she runs Meow and Friends down the southeast, and she's more than happy to talk to councils down that way about some packages and some programs to help you get your desexing programs up and running. Marissa, everybody, a lot of you have probably heard of Marissa as Second Chance Animal Rescue, or SCAR. She's won awards for all sorts of things, so she's doing some amazing things up there in the north. She is also happy to work with councils to try and get some programs and plans in place. The number there to get hold of Marissa is, that's just a vet clinic there, but if you, I didn't put Marissa's phone number on that because I wasn't sure that she would want everybody ringing her, but if you contact the clinic and ask to talk to Marissa or tell them what you want about, Marissa will call you back, and there's no problem with that at all. So we've got the southeast covered, I've got the north covered, and there's us, Westside Community Sexing. We're out in the west, we're in Sunshine. We signed the lease just a couple of days ago on a property out that way, and we're just waiting for the final council approval. But we're on a mission, Penny and I, to DeSex the West. That is what we want to do. We want to work with councils out that way and offer them some packages and so forth to help them get the cat problem under control. That's our contact details there. We have a Facebook page up and running. The website is being put together as we speak. We are hoping to be open to help the people out in the west in October, but I don't know, so I've put November as a possible starting date. This is where the $160 that I was talking to you about is, this is where it comes in, where we will offer councils out in that area. So if you're within Koori of Sunshine and you're a council that wants to make some differences out there, for $160 for this kitten season coming, we will DeSex, microchip, and provide an F3 for cats coming through a council organisation, a council package sort of thing. For it's not available to just anybody walking in off the street. It's designed to help councils get some progress and some programs in place that will help the cats out there. Now, as you saw before in the slide, I said 100 cats, and look at the money that you can save if you DeSex 100 cats. 100 cats to us is nothing. We can do 100 cats in a week. So if you want to have everything there within a week, we'll have you sorted in a week. If you can't quite arrange 100 cats in a week, we'll be happy for you to spread it out. But 100 cats is not a deal to us. We can do that, like I said, in a very short space of time in a week. So that is available for the people out in the west. And here it is. Here's my attempt at creating a ring of steel for desexing around Melbourne. So there's Westside Community out in the west, Scar up north, and then there's Louise with community, Meow and Friends Community Vet down south. So with that, I hope you got something out of it today. I hope you've got some information that you can go back and work with and encourage people, management further up above you, to help you implement some programs that will actually help you reduce some of your over cat population problems and reduce euthanasia, which is what I'm all about. So thank you for listening. I hope you've got something out of it. And yeah, and Nell, back to you if we've got any questions.
That was fantastic, and so much conversation going on in the chat. And yeah, and so let's move to the Q&A, which is where our questions are. We've got a question from Meg. Who is responsible for the long-term care of stray colonies that can't be handled unsocialised? If council helps them initially, follow-up vaccinations so the first isn't null and void, dental procedures down the line. Meg, I'm not sure that that's really a question for Anne or for this presentation. I'm not sure that it's, I mean, obviously animal management is the responsibility of local council, and I'm sure there are community groups in the area as well who will be assisting in that. If you want to chat more about that, give me a shout on the secretary email address, or give me a call if you've got the number. Are there any other questions that we've got for Anne? I don't have anything else in the Q&A.
Nope.
Oh, here we go. Beth, why is vaccination not being included when parvo, I think it's meant to be, is such an issue?
Vaccination for, but I was talking about including a vaccine.
Yes, yeah. So I think, Anne, if you just want to cover off on the vaccination part of your package.
Yes, we will include in the package that we're talking about a no, the $160 includes the F3 as well, the DeSexing and the microchip and the F3 as well. And then owners will be able to come back and have an additional vaccine if they want. But I am so keen just to get everything vaccinated. I mean, and just look at COVID now, what they're trying to do around the country with us getting vaccinated. It's the same thing.
Absolutely. Bella asks, is there any progress in changing legislation so that urban strays can be desexed? I know currently they need to be registered owned. Bella, I think that really depends on which state you're in, because obviously the legislation is different for each state. So probably refer to whichever state you're in for the answer for that one. And another question from Bella, how can we reach out to clinics on a greater scale to get support? Are there any campaigns or projects we can support? Yes, there are, Bella. So National DeSexing Network has got the Cooperative DeSexing Program, which works with councils and local vet clinics and pet owners. So have a look at the website, which is ndn.org.au, and yeah, see whether that fits the bill for your question there. Sky, we are starting a program to desex, microchip and vaccinate cats for vulnerable residents for free. Yay, well done. In conjunction with a local vet, are there existing resources to promote such a program, in particular resources in different languages? That's an excellent question. And do you know of any?
Yeah, Penny did find something about that. I can't think of it off the top of my head. I'd have to get hold of what it is, and I can flick it through to you, Nell, when I find out what it is. But there is some organisation around or something that will do different languages, because we need something in Vietnamese, and neither of us speak Vietnamese. So
yes. Yeah, and that's a really valid point. I agree. I've seen something on Facebook where there are some resources written in other languages. So we will endeavour to find that out, and I will put the link with this recording on the AIM page. So take a look at that once this is all up and running. A question from Debbie, has anyone approached the AVA for them to promote any programs to the vet industry? And do you know of
I haven't.
action there with the AVA?
No, I was actually talking to them about trying to get shelter medicine sort of involved in some of their specialty groups, which they were thinking about. No, I don't know if anybody's approached the AVA, to be honest.
So yeah,
I'm not a member of the AVA, so
no, I know the AVA have a voucher system that, in conjunction with Municipal Association of Victoria, so that's obviously just in Victoria, and it provides a discount to people who have vaccinated pets, and they have a discount. Yeah, what do you call it? A government support card. But other than that, I'm not sure that AVA have got much involvement in sort of promoting broad scale desexing, particularly of cats. But if anyone else has got any other info, then let us know. Okay, I don't have any other questions popping up in the Q&A box. So lots of discussion. Thank you so much, everybody, for attending. And thank you so much, Anne, for your presentation today. I think everyone's got a huge amount out of it. Just to let everyone know, I'm sure you've all heard because you're obviously AIM members, but AIM are kicking off a national online cat management discussion group. If you haven't emailed and you are interested in participating, then reach out to secretary@aim.org.au and I'll put you on the list, and we'll be getting back to everyone as to how that's going to work very shortly. But clearly there's a need for more discussion in this space. We need more time with each other to cover these issues. We need to hear from people like Anne, to hear about, what's working around the place, around the country. So if you are interested in that, flick me an email and I'll put you on the list.
Look, there's a question there from Fra that's asking about the source number.
Yep.
The pet registry thing. Source numbers used when microchipping an owned cat that's not admitted through council. Oh, that if you're talking about somebody that owns a cat, and where are they putting it to? If the cat doesn't have a microchip and someone's just got it from somewhere, the owner, if the cat was born after the 1st of July last year, so 2000 and what was last year, 20,
yep.
The owner needs to get the source number from the Department of Agriculture. Is that the question, if I've answered it properly?
Is a source number needed though if the cat is found, for example, under a house? They found a kitten under the house. My impression was that the source number was required if it was obtained from a shelter, pound, shop, breeder, or whatever.
You need a source number to register the microchip number. So if you can I can desex the cat without a source number. I don't need it for that and vaccinate and the rest of it. If you want to implant, in Victoria, that is, that I'm aware of, if you want to implant a microchip and then register it with either CAR or one of the organisations, they have a spot on the form where you have to put a source number in. And if the person found it in the car park or under the house and it is born after the 1st of July last year, so 2020, they need to personally get a source number. And I think it's $22.50. I think that's it, the cost.
Okay. All right. Thanks for the clarification on that. That's great. We've got a couple of other questions here. Fraz saying, I understand the legislation that the owner is required to get a source number, but don't you find that a deterrence? I think absolutely that would be a deterrence for us. So,
I'm not going to say anything about that.
Yeah, but it makes sense. Craig from Wodonga, what data do you have on the impact on wildlife from cats, as often they are feral cats causing issues? So that is a separate issue, is it not? Yes, Craig, I think that is a separate issue. And I don't think we have any data on impact on wildlife other than to say that if there are less cats, there will be less impact, I would imagine.
Yeah.
Karen, which will cost them another $22.50 to obtain the source number. Right, Karen, yes, I think that is what Anne's saying. Yeah. So thanks for clarifying that, Anne. All right, let's wrap up. Thanks for attending, everybody. Stay tuned to our social media pages and e-news for announcements about future webinars in the series. Feel free to send us through suggestions for topics or speakers that you'd like to see feature in the series. We appreciate your support. Thanks again, Anne. Fantastic presentation, and we look forward to having you back. All right. Thanks very much, everybody. Have a great afternoon.